Hello, hello. How are you? And I created a banner and I don't see it. Ah, anyway, how are you doing? Hope everybody is well. And trying to type and talk at the same time, which is not a good thing. Okay, let's see if it'll act right now. Okay, that was it. Okay, okay, sure. There we go. Okay. Hey. Okay. Today is National no World Pancreatic Cancer Awareness Day. And I know that's a dismal topic to talk about, but it is necessary. In fact, recently if one of my clients called me because her brother was having some issues and she was asking me questions. So I said, well, he needs to go get checked out. And I said, it looks kind of, from what she was telling me, it sounded kind of serious. And she called me back the next day and let me know that he indeed was diagnosed with pancreatic cancer. And the doctor said that it was very aggressive. Haven't found out the stage he's in yet or anything. But um, there are, it's a scary thing. Cancer's scary anyway. But when you talk about pancreatic cancer, that even makes it worse because usually when it's diagnosed later in stage because the very beginning of it, there's not any signs or symptoms really that people that make people go to the doctor and get checked out. So usually when the diagnosis later in life or it's later in the stage of the disease. In fact, my we had a nephew that had it, and again, he was in later stages by the time he was diagnosed. So that's one thing that we want to let you know about. That it's usually detected later in the disease, but also it's linked to 3% of cancer occurrences in the United States, and is 7%. It accounts for 7% of the cancer deaths in um, in the United States. So some of the risk factors that um, that put you at risk for having pancreatic cancer. Number one, just like everything else, is smoking. Smoking is one of the number one factors. Also, overweight. Obesity is another risk factor for pancreatic cancer. And that's why it gets undetected a lot of times because a lot of times people, when they're obese or overweight, they have a large abdomen. So any abnormalities in the abdomen really are not really seen or not really evident because of the size of the abdomen. Another, and the reason I'm talking about it, another risk factor is diabetes because diabetes is related to an abnormality in the pancreas. So the pancreas is not operating as it should. So that puts it at higher risk of developing a cancer there. Another risk factor is chronic pancreatitis. Now, pancreatitis is an inflammation or infection of the pancreas, and that has been caused by people who some medicines have caused it, and people ended up in intensive care because of it. Especially like with cholesterol medicine, people had adverse effects to cholesterol medicine. Also, people who are um, abuse alcohol. they are at risk of developing chronic pancreatitis. And because of the inflammation of the pancreas over time, that with um, you can end up with cancer of the pancreas. Another risk factor is environmental exposure. That means that if you are in an environment that you're exposed to a lot of toxins, metals, different things that you inhale or different things that you ingest, that you eat, you can develop pancreatitis. You can develop pancreatic cancer from that. And also family history. This is one of the cancers that's strongly linked genetically, that is strongly linked to family history. Now, is there any way to detect it early? A lot of times when it's detected early, it just happens to be found. I had a client, I had a patient when I was working in the clinic that that he had gone in for a checkup, and because of the checkup, they they found the tumor on the pancreas, so they were able to do surgery. And um, in fact, when I left, he was like 5 years out post surgery, so he had survived 5 years. And the thing about the surgery is, when you do surgery on the pancreas, a lot of times what's involved, the cells that produce insulin are affected. They're either removed or they're damaged, and that way, people who have undergone pancreatic surgery or some issues with the pancreas, they end up being having type 1 diabetes. That means that they have to have insulin in order to live. So that's another side effect that can occur when you have issues with the pancreas. But, okay, going back to the pancreatic cancer, like I said, it's usually detected later on in the disease. Now, there are some things that they can do. There's some surgeries that they can do, but a lot of the surgeries that they do, they're palliative. That means that they are relieving symptoms. And most of the times, the surgeries that they do are not curative. All right. It's not a cure. They can try to remove the tumor, but those cancer cells are they're microscopic. You cannot see them, and they can spread just by having the surgery. Those cancer cells can spread. So that's why a lot of times they end up having cancer somewhere else. So some of the surgeries that they do, they can remove part of the pancreas. And then there's this other surgery they call a Whipple procedure. And it's a very extensive surgery. And one thing about it, you only want a very experienced surgeon who is accustomed to doing that type of procedure to do it, because like I said, it's very extensive, it's very long, and they reroute a lot of things. Now, people who have had Whipples, if they have had Whipples done by an experienced surgeon, they can survive more than 5 years. But usually, if surgeons that are not who haven't done a lot of these surgeries, they may have done a few of them, but they may not have done enough in order to become proficient at it, that they can end up that the patients end up having different complications following the surgery, which is just as deadly. So, and another thing that they have found is that by the year 2030, pancreatic cancer will be the second leading cause of cancer deaths in the United States. Right now, it's lung cancer, and that is number one. But because of the increased incidence of pancreatic cancer being detected, they're predicting that it will end up being the second leading cause of death. So, what I wanted to come in and let you know, because this is World Pancreatic Cancer Awareness, to let you know these things that happen. So And like I had shared with you, a friend of mine, her brother has been diagnosed, and he was having issues a while ago. And come to find out, like his mother said, I looked at him and he didn't look good. And I told him he needed to go to the doctor and he just brushed it off. So, one of the early things that you see is yellowing of the skin or yellowing of the eyes, because what has happened, the common bile duct, which is the duct that comes out of the gallbladder into the pancreas in order to help with digestive juices, if that gets clogged, it gets backed up, and that's where the jaundice comes from. And when you see jaundice, that is a serious condition and need to go get it seen about. So if you know someone that may have some of the risk factors, if they smoke, if there's a family history, if they're overweight, if they look sick, if they just don't look well, encourage them to go to the doctor. Encourage them to go get checked out, because it's better to get checked out and nothing's there, as opposed to not getting checked out and then finding out that by the time you get diagnosed, you're in later stages where they can't do anything. Okay? So, that's what I have for you today. And I want to invite you to visit my website, totallyaboutdiabetes.com, in order to learn more about diabetes. If you have a history of diabetes, pre-diabetes, and or any other chronic health problems, I want to encourage you to visit the website. And I failed to introduce myself. My name is Trinette Stanford, and I am a nurse practitioner and health education specialist. And I have a company called Totally About Diabetes, which is a coaching, education, and support program for people with type 2 diabetes, type 1 diabetes, or chronic related health problems. So if you have any issues, if you have any problems, what you can do is post it in the comments, and I will get alerted to that. And if you have any other questions, you can post them on the website also. So I want to thank you for coming in, for listening, and hopefully this was informative, that I have given you some insight to something that may have been you may have heard of it, but you may not have been too much aware of it. Because Aretha Franklin, she had pancreatic cancer also. So it's something that can be treated, but usually the diagnosis is really dismal. Okay. All right. So hopefully you can have a nice the rest day. The rest of your day will be nice. And if you have any questions, please let me know. Have a great day. Bye bye.